Hello, it's Dr. Spiegel. Thank you for entrusting me with your surgery. I'm going to do everything I can with more than 20 years of experience to make sure that your results are outstanding and everything heals the way we want them to. Of course, every surgical procedure carries certain risks. Even when conducted well, some of these risks can occur. Every surgical intervention has the risk of infection, bleeding with blood loss, numbness in the area, or weakness of a facial muscle. This can result in asymmetry of your smile, difficulty closing an eye or lifting an eyebrow, and other changes. If we are going to be operating on your forehead, numbness afterwards is expected. Typically that numbness lasts several months before it goes away, but of course it could be permanent. Scarring can occur. Sometimes the scarring is undesirable and needs revision or hair grafting to hide it. Weakness of a muscle can occur. There can also be contour abnormalities, which means that when you feel your forehead, or even when you look at it, you might feel like something is asymmetric, looks indented, looks too far out, or feels abnormal to you. There are also things in the area that we certainly don't want to injure, such as the sinuses, the brain, the eyes, your vision. The surgery has historically been very safe, but of course these are in the area, and it's worth mentioning that those are concerns. When we're operating on your eyelids, there's a risk of dry eyes being exacerbated or newly created. Plus you can have malposition of your eyelashes in any way, in or out. And sometimes you can have what's called ectropion, which means that the eyelashes roll down and you can see into the lower eyelid more than you'd want to with a pink appearance. You can have swelling, asymmetry, visible scarring, difficulty with vision, double vision, and a host of other things that neither of us want to occur. When operating on the nose, it is quite likely that there'll be swelling that persists, sometimes resulting in scarring that can change the appearance of the nose in a way that we don't want it to be. In these cases, an injection afterwards and sometimes a revision can be necessary. Some people have reported change in their sense of smell, difficulty breathing, something called a septal perforation, nosebleeds, brain fluid CSF leakage, and other changes after surgery. If you have a runny nose before surgery, it is likely that the surgery will not change that in any substantial way, but it might. We just don't know how it will go. Sometimes people need a revision of nose surgery to get the best outcome. When operating on the cheeks, there's a risk of having an infection, and sometimes cheek implants need to be taken out and then replaced in the future when that can be done. Cheek implants can also be asymmetric, or you might feel like the size is not what you wanted, or that the appearance is different than what you wanted. For the jaw, you can have numbness, weakness, or a prolonged infection. Tooth injury can also occur, as can injury to your tongue from the surgery. For Adam's apple surgery, we're concerned about risks to your breathing, risks to your speaking, having your voice be worsened or lost after surgery, and of course there is definitely a chance of Adam's apple being visible after surgery no matter what we do. When you have a facelift done, we worry about risks to your facial nerve and movements, scarring, visibility of lines, return of wrinkles, return of sagging skin, and similar problems. In each of these cases, I can assure you that we will do everything we can to make sure the surgery goes well, and fortunately, historically it does, but it's important to be aware of the many things that can occur. Also of note, having surgery such as this does not mean necessarily that people will see you in any specific way after surgery. We do everything we can based on our experience and training to assure you excellent outcomes that will lead you to achieve your goals, but of course there's no way to be certain that things will go the way we desire. Now that I've scared you as to the risks of surgery, I want to assure you that in most cases surgery goes very, very well, and that's why we keep doing it. Thank you again for entrusting us with your care. We're happy to answer any questions and want to be sure that you are fully aware of all aspects of the surgery before we begin. We look forward to caring for you and helping you have an outstanding experience.